So plague is a bacterial infection caused by Yersinia pestis and was responsible for the Black Death in 1350, which killed 50% of people in Europe. It's transmitted to humans by fleas that infect rodents, and I like to think that it infects one of the three big Bs: blood, buboes, or bronchi. This is because it has three flavors of presentation: bubonic plague, septicaemic plague, or mnemonic plague. In terms of its pathogenesis and microbiology, Yersinia is a gram-negative bacteria which lives in the flea midgut. Here, it produces a biofilm that blocks up the flea's blood-feeding tubes, which means when it does bite, the bacteria inoculates the mammal host. From the site of the flea bite, the bacteria spreads rapidly, surviving and replicating in neutrophils, which then travel up to the lymph nodes. Here, it massively replicates again, causing swelling of the lymph node and periglandular region, known as a bubo. The bacteria continues to spread sequentially, eventually resulting in massive septicemia. Let's briefly discuss the clinical features of the three big Bs. In bubonic plague, which is the classic presentation, a sudden high fever is followed by lymphadenitis, which is increasing pain in the regional lymph node near the bite. This bubo manifests as a tense, tender swelling, often in the inguinal region that has a boggy consistency with an underlying hard core. In blood plague or septicemic plague, it presents with hemodynamic instability with hypotension and shock. This occurs without preceding lymphadenopathy. In bronchial plague or pneumonic plague, infection results from direct inhalation of bacteria from another person. And this is someone who's already got primary pneumonic plague, or someone who's got secondary plague pneumonia after it's spread to their lungs from a bubo or from the sepsis. This type of plague has a short incubation period, followed by acute respiratory signs like hemoptysis. For the investigation and diagnosis of plague, appropriate specimens might include a buboaspirate, bronchoalveolar lavage fluid, and blood cultures. But realistically, plague is very rare in non-endemic areas. However, in scenarios like the 2017 Madagascar outbreak, bacterial antigen strips were historically used for diagnostic purposes. For the management of plague, antibiotics are effective. Historically, streptomycin has been used for 2 weeks, but in view of its side effect profile, gentamicin might be a better option. For pre-exposure and post-exposure prophylaxis, levofloxacin is approved by the FDA, and historically, vaccines for this disease have had poor outcomes, although some governments are still pursuing their development. Let's recap with a dark, silly mnemonic. Rats and fleas spread Yersinia with ease. Yersinia killed with three big Bs, 50-50 in 1353. Thanks for watching Townsend Teaching.